Hi, my name's Eaton. I'm a clinical specialist with Chattanooga. Today I'd like to talk to you about the INTELECT radial pressure wave. Now, radial pressure wave is sometimes referred to as radial shock wave. Not strictly speaking true, but as a marketing tool, this is considered as a shock wave machine. But its true name is radial pressure wave. We produce pressure waves which create something called mechanotransduction within the tissue. So mechanotransduction is a normal process that goes on within our tissue, and is a response to load. And when we put load through tissue, we create tension, shear forces and compression. Now, these forces are picked up by the cell, and the cell then adapts its behaviour accordingly, dependent on the type of tissue that we're loading. So radial pressure wave is an artificial way of creating mechanotransduction. Now, mechanotransduction is affected by pathology. In fact, if we look at Jill Cook and Greg Purdam's work of 2009 in their tendon continuum model, they talk about if we allow a tendon to become degenerative, then our exercise prescription won't be effective. Now, it's also been demonstrated that through shock wave, we can artificially produce mechanotransduction, and we can get a 5-fold increase of inflammatory markers and the catabolic processes, which can enhance healing and regeneration of a tendon. So the inference from these studies is that we can take a degenerative tendon back to a reactive tendon where our exercise prescription becomes far more effective. So in a nutshell, when we're talking about radial pressure wave, we're talking about a pro-inflammatory modality. A modality we use for chronic pathologies where the normal healing cascade has stalled and we effectively need to reboot it. We're going to take it back into the inflammatory process to restart, to reboot, if you like, the normal healing cascade. Now, the effects I can tell you as a clinician who's been using shockwave now for over 8 years is that I can take a chronic condition. I've had patients that have had these pathologies for 6, 12, 18 months. I can think of one lady for a 2-year history. Within a 3-week period of incorporating radial pressure wave therapy into the patient's management, we've made a significant improvement. And this is supported by the literature. I can point to systemic reviews that have demonstrated that radial pressure wave across all modalities, both upper limb and lower limb, will have an 89% positive outcome. Now, I think we owe it to our patients if we can give them practically a 9 out of 10 opportunity of making a significant improvement, that we should consider modalities such as radial pressure wave.